I may have to sit down quite a lot during this talk. If anybody can't hear, can they please just stick their hand up and let me know, because I want to make sure everybody can hear. Okay, I'm Jane, as Tim said, life member of Enfield Centre for Natural Health. A little bit about me. I was a social worker, mostly working in hospitals because I liked the medical setting. Until 2000, I was very disenchanted with social work, and social work was very disenchanted with me. I didn't fit in anymore, because when I first started social work, it was very much child-centred, and then it came more and more process-led and all about outcomes, and there was very little opportunity actually to talk to people, to do any preparation work, and I felt that I wasn't in the right place. So before that happened, I mean, I just thought I need a different job. I didn't find another job. So the first thing I actually did in terms of complementary therapies was healing. Started with me doing a course in psychotherapy with a spiritual dimension. I hadn't got a clue what it meant, and I didn't know why I was drawn to it. But that was where I first came into contact with healing energy, and I was quite literally shocked, because I always felt I was different, and as a child I was always looking out of the window and getting told off for daydreaming, and I was always in the teacher's bad books. And I thought there's something wrong with me. I had a very, very vivid imagination and imaginary life, which didn't go down too well. So I started on this course. I did the first year, which was the counselling part of it. Couldn't continue to do the actual full course to become a qualified psychotherapist. And then I actually met Tim. In 1993, Tim was starting his Enfield Centre for Natural Health and putting up feelers to see what there was in the area, and we had an energy thing. And Tim had just done this course, this healing course with Delcia McNeil, which was therapeutic healing, and I thought, right, I'm doing that. It was just instant. That's what I wanted to do. I'd come into contact with the healing energy, and I wanted to work with it. 3 years. 3 years training, personal development, very important part of learning to be a healer, very important. And it really attracted me. I started practicing as a healer, but I also needed to make a living. I was working full-time then, but I needed, you know, if I was thinking of a future career, I was only in my 50s, and I wanted something that could earn me a little bit extra. Healing at the time wasn't really bringing me in money. Not to be too materialistic about it, I'm just being practical and realistic. So I started training in massage, doing what we call holistic massage, doing Indian head massage, massage with babies. Then I went on to manual lymphatic drainage. I was doing a lot of work. I was part of a consortium working mostly in the Barnet area, and we had a lot of work. We worked with Sure Start, and there was a lot of work, and it was very successful at the time. And I hurt my back, and when I first hurt my back, it was a terrible shock. I went into a depression, I suppose. I thought, what can I do if I can't do this work? And it was like a sudden revelation, really. Oh, well, you could do reflexology. You don't have to, you can do it sitting down. It's more relaxing for the body. I mean, massage is actually quite stressful for the body. And a lot of people I know who've got a bit older find it really difficult to do. There are ways of adapting it, like no hands massage and bamboo and all that kind of thing, but it didn't really appeal to me. So I started training in reflexology, and I'd also developed an interest in working with people with cancer, which is actually why I was attracted to doing manual lymphatic drainage, because I thought it would help people with lymphedema. In fact, it meant doing another 2 years after that course to specialise in all the bandaging and all the lymphatic work that you do, so I didn't do that. But I had developed an interest in cancer. I was working with a cancer support group in Enfield, which was wonderful, and I did the Macmillan training for cancer support. At that particular time, my best friend got cancer, and I wanted to try and help her, and she really benefited from reflexology sessions. And she spent her last days in the hospice in Hampstead, Marie Curie, and I thought, I'd love to work there. It was so peaceful. And when she got there, she'd had a very rough time in hospital, and she said, "Jane, I think I've died early and landed in heaven." And I thought, well, you can't recommend a place higher than that. It took me a couple of years before I felt I was ready, and then since 2011, I have been working as a complementary therapist. And when I first started, I was told, do not mention the word healing. I was there as a volunteer to do reflexology with the patients on the 2 wards. I actually got told off. This is so 1970s, it's untrue. But one of the ward managers told me off. He said, "We've heard you mention the word healing." And I was too scared to stand up for myself. So I just let it go. But I thought how outdated and antiquated some people's thoughts are. They're so rooted in the medical side of things, they can't see beyond that. So I started working on the hospice. I was really, when I first started reflexology, I thought I would never learn the sequence. Then it gradually became incorporated into my way of doing things. So I didn't have to think too much. When you do any kind of therapy, you've got to switch off your thinking. And I found that quite difficult to do. You have to work with your emotions, with your senses, and not so much with your head. Heads are for talking, they're for reasoning. And they're very useful. We have a mind, and it's a very productive machine. So 3 years ago, I approached one of the consultants in oncology at the Whittington, because it's my local hospital, and she had only just been in the job for a few weeks or months, and I said, following what Angie was prepared to do, I could actually get paid as a healer. Unfortunately, it wasn't seen that way. I could do reflexology, but not healing. So I thought nothing would come of it. And then it was 4 years later, I suddenly got an email from her saying, "We have a Macmillan team starting here. Would you like to join them? Have a chat with them." And that's how I set up a clinic at the Whittington. I am really proud of it. I've learned more from my patients than I've ever learned from anybody. When people come into a medical setting, they're scared. particularly when they are facing a diagnosis of cancer. It's terrifying. They're all over the place. And I have a slot of 3 hours once a week in the afternoon, because the oncology unit is very busy. Patients come in about 9 o'clock in the morning, and then by the afternoon they're tailing off. There's nobody there at 3 o'clock, so they wanted me to work in the afternoons. And I thought, how on earth am I going to manage these beds? At the hospice, I can take the end of the bed off, or the patient, if the patient is able to and wants to, they can sit in a recliner. Easy. But, you know, you'll have to remember the therapist has to be comfortable as well. And at the Whittington, it turned out to be a piece of cake. I just piled up cushions, put towels over the top, and people have to be relaxed before they start a treatment. So I don't know how many of you are familiar with reflexology, but this is a map of the feet here. When you open a book, you have the central part and the spine. So the spine would be here, and then you open it. So this here, on each side, is what we call the spinal reflexes. And when we start with the top of the foot, which is, just a moment, I have got some handouts for you. So I haven't got enough to give to everybody because my printer won't scan, so I had to go to the library, and it costs an arm and a leg. So if you would be willing to share, here we are, you can have that. This is basically what we call the map. It is in a way a bit like a map. Would you? That's very sweet of you. Yeah, so what we're doing is we're working basically from the top. So we start with the right foot, we go through, the big toe represents the head, the top of it is the brain. All reflexology maps are different, unfortunately, so this doesn't perfectly coincide with the teaching that I did. So then you go down into the various body parts. On the right side, this is the right foot here, on the right side, because the liver is more on the right, we work the liver. Because the stomach is slightly to the left and the heart, we work those on the left foot. Otherwise, everything is identical. And there are certain points on the feet. There's another one. No, it's there's a very significant point on the feet is the adrenal. It's tiny, it's about the size of a pea, I think. And the adrenal gland sits on top of the kidney. It's something that I kind of go to first because I can tell how stressed somebody is. I've also got hands. I've got some maps of the hands. There are occasions when I can't massage somebody's feet. They may be ulcerated, they may be very sore, they may be amputated even. So I would work on the hands, but the hands is a useful tool because you can do it on yourself much more easily than you can do reflex on your feet. So that's one thing I do use it for. And also I can show, I show people the points that they need to focus on. But in cases where I can't work on the feet, and by the time people get to the hospice, they often have pressure sores and things on the heels, and I don't want to touch a foot that's sore. So I would work on the hands, but it's not quite as effective. So that's basically the plan of what reflexology is. I'll go into that in a little bit more detail. So reflexology has a history going back thousands of years, which we've seen pictures. I'm sure some of you will have seen pictures. The Chinese were practicing pressure-based therapies. Now, traditional Chinese foot massage is not reflexology. It's very different because they do put on a lot of pressure, but that not in particular ways that we do with reflexology. The Egyptians, you can see frieze paintings with the Egyptians massaging each other's feet. They found different oils. They were very keen on massage. So you find in the tombs there oil, flagons of oils and things. It was obviously they were into some kind of body work. Something developed in the 16th century in Europe called zone therapy, which was therapy by pressure. And it was practiced all over Central Europe in many different settings, rich and poor. And it also, we've found it exists in some indigenous populations in Africa and Australia and America. But the turning point really came in 1913. Dr. William Fitzgerald, who lived in America and Connecticut, and he was a GP. He was also an ENT specialist, and he'd worked all over the world, and he began researching this technique which they called zone therapy. And in zone therapy, the foot was divided into vertical sections. So this is the start of it, and the zones you can imagine on the outside, but they actually go to the insides as well. And it was like dividing the body, longitudinal zones, working on those. During the 1930s, that therapy was being developed by another American called Eunice Ingham. I read her books. She wrote, the first book was called Stories the Feet Can Tell. And that is what feet are to me. They tell a story. When I look at feet, I can tell the kind of mood that person is in. This is just a visual assessment, what mood they're in. Do their feet feel heavy or light? Do they flop out to the side, or are they rigid? What colour are they? What are the skin colour, skin tones? Like, is there red and hot areas on the foot? All that kind of thing. That's very basic. But she wrote a couple of books, and this was the foundation of modern reflexology, and the only thing was they were still very much experimental. They were in the empirical stage, and they were considered too symptomatic and insufficiently scientific. This is how therapists think. We're not thinking purely scientifically, we're thinking about what it feels like, energy. Because we're all composed of energy, we can't deny that. We are energy beings. And in my view, I cannot, well I could, but I wouldn't want to do a treatment that is purely focusing on physical symptoms. Physical symptoms are very much the way allopathic medicine looks at disease. What are the physical manifestations of this illness? It doesn't look beyond that. When you have the aura on the foot, the furthest, the nearest is the one the doctors work in allopathic medicine. It's the physical. And beyond that, you've got emotional and spiritual auras. And I found more and more I'm working in the outer auras rather than the inner ones, so I combine it. So reflexology is actually, since the time that it was first developed, has diverged into different people interpreting, or rather augmenting, reflexology. And sorry, I've lost my bit of paper. Incorporating other therapies, not because they don't think reflexology is sufficient, but because reflexology is so flexible, it can work very well together with other forms of therapy. So, just a second. Right. I have looked at many different kinds of reflexology. We have a colleague here called Louise Exeter, who does what is called chi reflexology, which is based on the Chinese energy system. Vertical reflexology apparently reinforces the treatment. So you give a normal foot treatment and then you press certain points on the leg which are supposed to enhance it. There's neuroreflexology, which focuses on working with the nerves for pain relief. We have craniosacral reflexology. I went to this talk, I couldn't understand a word of it, but it's just to illustrate that reflexology is so adaptable. You can incorporate it into other ways of working. Hypnoreflexology, I'm not quite sure what that is, I've just read about it. And briefly, very briefly, is a mention of what is called chakra reflexology. Now, having trained as a healer, the chakras are as familiar to me as ABC. And I thought, wow, I really like this. And I am working on this, evolving, I would say, this new way of working, because I feel it's very complete. It's very inclusive. For me, reflexology is working far more on the physical. The only person who has done a lot of work in this field is a French woman called Martine Faure-Alderson. She's a French lady, but she lives in England. She has practices here. And this is the book. It is very, very complex. This is a textbook, really, for reflexology. And it's very interesting, but it's very, very complex and very complicated. If you want to do her course, it takes 2 years, and it's probably costs the earth, and it's probably in France or something. But she has started, she believes that this is the only way of working. And what she includes is she's working, incorporating osteopathy, craniosacral work, and the chakra system. She has actually trained in many different diverse therapies. So she is way advanced what I could do in my lifetime. But I'm particularly interested in the way healing can be incorporated into reflexology. And my view of it is we all need healing. What does healing mean? It doesn't mean curing. It doesn't mean taking away somebody's illness. That's a very old-fashioned way of looking at it. Something that doctors, I think, were scared of. Now, I'm a complementary therapist. I would not ever call myself an alternative therapist. What I may be doing could be considered alternative, but it's not a replacement. I would never advise anybody, stop your drugs, stop your medical treatments and just do this. That is irresponsible. If somebody decides of their own free will, I would talk to them in great detail about it. And I wouldn't be the only one. I'd advise them to talk to other people, because you can't just stop. There are people who've tried, and some people have managed self-healing with great results. But it's not something I would advocate to use on its own. I show people healing techniques, and I show people how to heal on their body. But it's not, it's a supplement, the treatments that I give. When you think about it, chemotherapy ravages people's bodies. It affects every cell in your body. It is devastating. It's like, I would imagine, being hit by a barrage balloon. And just having somebody to hold your hand and talk to you is very comforting. The doctors that I work with are actually very sensitive to people's needs. And you know, the patients at the Whittington and at the hospice are treated with total dignity, kindness and compassion, without exception. But still, it's very rigorous what people have to go to, and my heart goes out to them. My patients have taught me so much because they're so brave. And when I hurt my back, I went into the victim, because I thought, you know, why me? Why has this happened to me? And all this kind of thing. And then I turned round. I do get messages. I do try and, when I meditate, try and get messages from spirit. So I was being told, use it. Your problems are not life-threatening. You can deal with that. And it was telling me to go and work with people who were a lot worse off than me. I guess that's possibly a lot of the way a lot of doctors feel. You want to help people. It also gives me a sense that the suffering I've been through isn't in vain. I can actually use it, convert it, and that is such a good feeling. I've got my power back, if you like, and without your power, you can't function. And this is what happens to a lot of cancer patients. They feel powerless. The number of appointments they have, the number of follow-ups, the number of blood tests, the number of scans, it's relentless. And just to be able to sit for an hour with somebody who you can have a chat to if you want, but who is with you in that space and can give you some comfort in that particular time frame. It's the here and now that we work with. So this has been evolving really over the last few months, and particularly from my work at the Whittington. I'm very, very proud of that, and I thought I was doing a service. I didn't think how much it would teach me. We have a volunteer who is happy to show us her feet. We've discussed this before. Is that all right, Jill? I'm just trying to think where I can put the couch where you can all see, because I'll be working with my back to you. This is not a demonstration in the sense that I'm not doing a treatment, I'm just using it to show you. What we have here, when you think about your spine and your chakras, I hope you're all familiar with the chakra system of energy. You go, would represent, well, start at the bottom. This would represent the base chakra, going up to solar plexus, sacral, solar plexus, heart, throat, and beyond, you know, the crown and beyond. So it's actually a perfect microcosm of doing a full body healing. So, footwear. Oh, don't lean forward. Don't lean forward.
Balance.
Yeah, lovely. So, this is the way I approach a session now. The first thing I do is, this is where I connect. I do my preparation when I wash my hands, I clear the space, I ground myself, and I bring in the energy, I call in the energy. So when I usually have a little chat first. I don't need to know where the patient has had their cancer, but they do like to tell you. They even like to show you their scars, because they're proud of it. It's a badge of honour in a way. They've got through. So this is how I connect here. I don't know if anybody can see, but this is what the medical people would call the pedal pulse, the femoral pulse. Goes right down here. Now Jill is amazingly fit. She runs marathons for us. That's how fit she is. Well, half marathons now.
Half fit.
Yes. But
No, still fit.
it's amazing. But I can feel that here. Now, what I do, what I've started doing, is I connect with my heart, because my heart is telling me that this is about compassion. I really feel for these people, and this is what I'm doing. It's like that. I'm creating a sort of bubble, connecting with my heart to their heart, which is also there. But so that's how I start. And when you first look at the feet, I look at the temperature, yes. I look at the condition of the feet. If the feet are in a really poor condition, cracked and sore, I think to myself, this person may be depressed. They may not have the energy to look after their feet properly, because we don't see them, we tuck them away. So I'll be examining just visually, and I'll feel the weight of the feet. These feet are light, but I will be able to tell you whether that person is relaxed. Sometimes people go overboard with their relaxation because they're exhausted, so their feet tend to flop out to the side, and that is a good indication to me. And because I have got their feet in my hands, that is the start of a healing treatment. And I can feel like when you feel the aura in a body, I can feel an aura in the feet. And when we do the treatment and there is a reflex point, either the patient jumps, it's a bit tender, or I can feel, it's difficult to describe, it might be congested, it might be like there might be crystals under the skin. There is something that just doesn't feel right. In other words, it's out of balance. It may be very subtle, and most patients going through this horrible business of chemo and radiotherapy and all that, it destroys the healthy tissue of the body. What we hope is that the healthy tissue will eventually restore to normal. When you think about it, the body actually wants to be normal. The body has a desire to be balanced. It's a natural thing. A balanced body is a healthy body. So I'm not at all surprised if people going through an illness, their body's unbalanced. That doesn't surprise me at all. And what I'm doing is trying to work with that to bring balance back. Reflexology is not magic. It's not like waving a magic wand and everything will be all right. It's not at all like that. But the more I've worked with it, the more I have realized how much of an energy therapy it is. More perhaps than a physical, or as well as a physical therapy. So this is, when you look at the foot here, after I've done the treatment, I've got a nasty blister there. Is it sore?
It's got hard skin here.
Yeah, we'll look after that. People tend not to moisturise their feet. A lot of black people do, because in my experience, black people have drier skin, and some of them are brought up with the their mothers teach them you've got to use oil or whatever to moisturize your skin. And black skin tends to suffer more from chemo. You get large patches of pigmentation. This often really distresses people. They may get it on their hands, or certainly, a black person's palm will be white, pink. Yeah. They tend to have discoloration on the palms. But where does everything go? Everything ends in the feet. You have circulation, lymphatics, everything ending in the feet, nerves, blood vessels, everything. And the feet are wonderful because they do work so hard. But they will bear the brunt of the chemicals, and they will also show you things like, is this person balanced in the sense, have they got a healthy lifestyle? I don't know enough about nutrition to be able to give people detailed advice about their diets and exercise and all that, but there are plenty of, I can point them in the direction of other people who can. Macmillan is amazing. It's got hundreds and hundreds of booklets giving advice about every condition, how to manage everything, and they run groups, they run exercise classes. They are amazing. So I can pass people on to the Macmillan organiser. So that's basically what it does. And with the chakras, usually when I finish the treatment, I'm working along this edge. Just relax your foot. So I start here, and it's just a very gentle touch. I'm just bringing my fingers in contact with the skin, but I can feel what's around, it's like what kind of energy it is. So then you go up to sacral and gradually solar plexus, heart, and strangely enough, it's not strange, this here, it represents the heart reflex. So then I work up very gently, because we're working with energy. If you do healing, you don't press, you work very gently and very sensitively, because the energy system is very sensitive. You can damage it if you force pressure on it. So then I get up to the top and then I do this. Some people can do it with both hands. I prefer it to do, I do one and then the other, and then I do both. And that, I'm hoping, will bring more balance to the body. It stands to reason. I haven't had enough time to know whether people feel the benefit of that. But it's difficult to say, but I do have some clients I've seen for 6 months. I've seen one client in particular from diagnosis, through chemo, through surgery, it's cancer of the esophagus, through surgery, through more chemo and radiotherapy. And he is a very enlightened man. He happens to be an acupuncturist, so he has a lot of understanding. And he also supplements the reflexology with acupuncture himself. He trained as a acupuncturist himself, so it's like he's particularly interested in that way of working. And I have seen huge improvement. He has really managed his condition very well, and very dedicated to helping himself. The worst thing is when people give up, because, well, I just find it really sad. It's understandable that people sometimes feel they've gone through too much. They just want to be left alone, really. And that's another time I can come in and give people some reassurance. A healing is very comforting, and it also restores people's sense of belief in themselves somehow. So they're more in touch with their power. I can't imagine anything worse than cancer to render you powerless. You lose your hair, you're disfigured, you've got all this going on. And, you know, people are so brave, they accept it. They want to live. That's understandable. And some of them have children and parents, and they want to continue with the family role. And I can understand if somebody gives up. It's their choice, but at the same time, you have to do your best to try and keep people going. There may be a very good reason for them to be able to get through that. I feel more sorry for people who are living on their own. I saw one man recently, his wife died about 10 years ago. He has 3 children, 2 of them living abroad. One of them lives with him, but she's out all day. And she comes home late at night, so it's better than nobody, but she doesn't really do much in the way of supporting him. And I really feel sorry for these people, because to do it on your own is not easy. You haven't got somebody there, if you don't feel like it, cooking you a meal or bringing you a cup of tea or making you comfortable or whatever. So it's all right, you can go now, unless you want to stay there. It's very comfortable. But if you do want to get up, you need to adjust these. There we go. Yeah. So we've got plenty of time, so I just wondered if at this stage anybody wants to ask anything. Anybody, any questions? Yes, Tim.
Jane, I've become aware of the same map that's on the feet. As you said, it's on the hands, but also on the ears and in
Yes.
the mouth. What's your explanation for this sort of holographic approach? How is that? Does it go down to a cellular level? How do you see that as being the case and how it works?
It's only a guideline. When you see the map, it's really like seeing a map of a route where you're going. You don't see all the things along the way. It's very two-dimensional. There's an awful lot going on behind the scenes. This is three-dimensional. So, you know, our whole bodies are three-dimensional. So it's very flat. We can't do it in 3D. Well, maybe we can at some point. Maybe we'll be able to do that. But there are slightly different variations. I don't really know anything about ear reflexology, except that it relates very much to the ear acupressure points. And there are some crossovers between reflexology and acupuncture or acupressure. Reflexology is not acupressure, but some of the points coincide with the Chinese system. So if anybody wants a hand, there are some hands here. And this you can do, I mean, take for instance, the adrenal. Now, okay, where are the adrenals? On top of the kidneys. So you start off with the bladder, which is at that point there. This is the kidney, and this is the adrenal. The adrenal is very often enlarged in people because of the stress in our daily lives. Stress can be positive in smaller doses, if you like. If we didn't have any stress in our lives, we wouldn't be motivated to do anything. We'd lie in bed all day. Most of us don't want to do that. We need an impetus, if you like. But these days, people are loaded, overloaded with stress. It comes from the lifestyle we have. It's very competitive, it's very on the go all the time. There's a lot of connection with artificial, well, computers and all that kind of thing. There's pollution. All these things are stresses to the body. So a little bit of stress is acceptable, but not if it's, I mean, I've seen adrenal points that are literally throbbing because they're so distressed. And what we do is we work it out. Now, most of the movements we do are like the caterpillar with the finger or the thumb, quite gently. And I always work very gently because most of the people I work with are quite frail. People like it to be gentle. If I press too hard, I'll get told off. So you work around that point. You gently, what we call, work it out. And then I will give somebody a diagram of how they can do it on themselves, where the reflex point is on the foot or the hand. Somebody else may do it for them, or they can work their own hand, which gives them some homework to do. sometimes if people can't sleep, it helps to gently massage that point, rather than taking chemicals again. But sleep disturbance is so common.
And would you press the adrenal point?
Yeah.
Okay. And you just use your thumb?
Yeah, you can use your finger or you can use your thumb.
Yes.
So just be very gentle, don't press it, just gently massage it. And that's just one of the things. I mean, I can advise people about other aspects. Most of the time I'm advising people how to look after their feet, because, you know, diabetic people really need to look after their feet. Some people have cancer and are diabetic as well, which is a double whammy. Some people don't need to moisturize their feet normally. When you are going through chemo, you do, you really do, because the skin can, I have seen people with chunks of skin falling off their feet. It's really sad. When I put cream on it, it can usually get most of it off. Stuff comes off in chunks. It's dead, you don't need it, but you need to get rid of it so that the new skin can form underneath. And any cracks, dry skin tends to crack. Any cracks with somebody's lowered immunity can become infected. You don't want infections on your feet. You've got enough problems. So I do spend quite a bit of time teaching people how to look after their feet. It's too much effort for some people, and if they haven't got anybody who can do it for them, it's really difficult. Most people do have somebody around who will put a bit of cream on their feet for them, or they can manage to do it themselves. So that's one thing I do. And a lot of people, you know, when you have adrenal symptoms, these are the people who have stiff, rigid feet, always anxious, always on the go, going from one thing to the other, having to cram everything into a day that they possibly can. I used to be a bit like that. You know, I'm old now, so I've slowed down. But sometimes you have to tell people, it's all right. It's all right to rest. You have permission to rest. You're going through a really difficult time. Respect your body. And these are the kinds of things I tell people. If they want advice about diet and exercise, they can go to Macmillan. I don't have the expertise to deal with that. But I have just found it so rewarding in developing that way of working, because it took me a while of doing reflexology, which I've been doing 12 years now, 10, 12 years, to realize how much of an energy treatment reflexology is. When we're taught, we have a great lengths going through the details about the pressure, about the routine that you do, what you do here, there, next. And I don't forget all about that because it's ingrained now, but I may not do it in that order. I do what my hands tell me to do. So if the feet, for example, are very red and angry, I'll just hold them. When we did actually get told, and when you do Indian head massage, you're taught about balancing the top chakras. So you start throat and then go up to the crown, yeah, and the crown. You do it like that, and then you kind of sweep the aura all down the body. But when I did reflexology, it was very much, yes, you greet the feet, which is a lovely way of looking at it. You know, I want to welcome people's feet. Some people feel ashamed of them. To me, there's nothing at all. I feel sorry for feet, yes. I feel compassion with them because they reflect so much about what that person's going through. But it never put me off. And you do have feet that don't smell too good, but I clean them first. It doesn't bother me in the slightest. I'm not put off by anything. You know, when you're a doctor, you can't faint at the sight of blood, and you know, you have to get on with it. And it's the same, you know. I mean, I have huge compassion, particularly when my clients' or patients' feet look really sore. And you know, that's why I work from the heart, because my heart goes out to them, and I find that a very good tool for working with people. It's working with compassion. So I'm engaging them. I'm also looking at them visually, so I'm making eye contact. Some people never get eye contact. It helps me to focus into that person. It helps them to feel I'm interested in what I'm doing. I'm linking with them. I'm sharing their journey with them, if you like. And I just find it such a rewarding way of working. Gone are the days when we say you can't use the word healing. It implies you're going to offer somebody some miracle cure. There's no such thing as a miracle cure. And you can't give people false hope. You can't even suggest to people that you can make them better. All you can do is suggest to them that you're with them on their journey and you can make them more comfortable. You can help them relax. The one greatest feedback from reflexology is it's relaxing. I often find people fall asleep. Which is a good thing. I'm very happy to see them fall asleep, because it means that, you know, maybe they haven't slept all night or something. They're getting a bit of respite. Now, the last thing I wanted to talk about was research. Now, personally, I'm not really bothered by research. I focus very much in the here and now. But the world out there wants us to prove that what we do is helping. And that is because it has to be accountable. Everything that people do has to be accountable. There has to be guidelines. It has to be controlled, kind of thing. You know, we have to be professional. We have to act within the regulations of the organisations that we train with. We have to follow up with all the CPD and stuff, you know. But for me, the outcome that I'm interested in is, have I given that patient or that client half an hour of respite? That's really what the ultimate aim is, and that always works. If you look up on the internet, if you look up research, a lot of the research is done in America, and it's not very recent. But just to sum up what I've picked out of the values of reflexology is how it helps with a range of symptoms, anxiety being one of them. And when you are working with anxiety, you have to be able to teach people how to do it themselves. Cancer, it certainly helps with pain relief. and it certainly helps with relaxation. It has some effect with diabetes type 2, but probably in conjunction with diet and exercise, I would imagine, because they are key in dealing with diabetes. But diabetes is often stress related, can be brought on by stress, so, or exacerbated by stress. There's some interesting studies with migraine. When I did Indian head massage, I worked a lot with people with migraine, and I did find it very effective. And sometimes the after effects of migraine, like somebody's face may be a bit, you know, numb. So I have had experience of working with that. They say with MS, now I've worked with people with MS who can't feel their feet. And they have a lot of tingling. Apparently it does help with that. It should help with balance and things and coordination, but it's not very well researched. You know, there's no point me thinking, oh well, reflexology and healing can cure anything. It's just kind of helping along the process. Relaxation is a key in getting better. The body needs to restore itself to natural harmony. It's apparently, there's some studies which I've heard about, which I listened to a talk about, very effective in helping women with menopausal symptoms, hot flushes and so on. And I do have quite a few patients who are going through breast cancer. They have tamoxifen for 5 years. They have like a menopause for 5 years. I really feel for them, but you know, these hot flushes are very troublesome, especially at night, and apparently it does help with that. Sinusitis, definitely I can confirm that. With sinusitis, with sinuses are on the other side, the front of the toes. So over the top and around the back, round like that. So, and post-operative, well, with sinusitis, they found it was as effective as nasal irrigation. I've had that. It's horrible. You sniff up one nostril and then it comes out. Oh dear. No, I would rather have reflexology anytime. And post-operative nausea, very, very common. I've had it myself. And you know, they have to give you the anti-nausea medication, and that isn't too nice. And well, unfortunately, I'm not there all the time. You know, in the hospice, I'm only there once a week. At the hospital, I'm only there once a week. The hospice is an incredible place to work because it's totally holistic. The consultant, well, there are two consultants. The one I see most often, he'll come up and give me a bear hug in the corridor. You know, they're very compassionate, very humane, very human beings. And so, you know, you've got that already there. And, you know, they love the therapists. You know, we get very good feedback because they understand that we're giving the patient something that they can't give. And some patients never get touched in a non-obtrusive way. They have needles stuck in them. They have tubes coming out of them. They have all this kind of thing. They need somebody just to hold their hand or stroke their head and say, it's all right, you know, I'm here, kind of thing. Nurses, you know, all doctors have to maintain a certain professional distance. We do as well, but not to the same extent. I mean, obviously, all the rules apply about touch and things like that, inappropriate touching. We have to be very careful. But if it's done in a therapeutic way, I mean, if somebody says, don't come near me or anything, I'm out the door. I won't try and stop. You know, some people just don't want it. And some of the most difficult people to help are patients with mental health problems. A lot of, I mean, I worked at the outpatient, the day centre at Edgware Hospital. Was it Barnet? It moved to Edgware, but it was Barnet General Hospital. And we had various therapists working there as volunteers. And some of these patients were very open to it, others were very difficult to reach. And I remember one woman, young woman, who said, I don't mind giving me healing, but please don't touch me. I said, fine. So I did a healing above the body. She had a cardigan on right down to her fingertips. And I just thought about it. And then a couple of weeks later, I did a weekly treatment with her. After a couple of weeks, she took her cardigan off because she felt she could trust me. You can imagine what I'm going to say. She had knife marks all up her arms. There wasn't any space in between them, covered in scars. And I actually did eventually touch her arms, just to say, look, it doesn't matter. You know, you're still a person. You're not ugly. You're not horrible. You don't need to hide away. You're just somebody who's suffering. And that was very moving, actually. Some people with mental health problems, you can't reach them. Others are all over the place, and it's very difficult working with that kind of energy. I don't do it now. I mean, but you do come across patients, obviously, who have other problems apart from the physical ones. Anyway, I've kind of reached the end of what I wanted to say. I'm just thinking if there's anything I can add. Would anybody like to ask a question or? Yes.
Had any experience of treating people with epilepsy?
Pardon?
Have you had any experience of treating people with epilepsy?
Yes, I have. In the cancer support group, there's a woman with epilepsy. Some people tell you mustn't do the top of the head, the brain. She's very well supported with medication. Most of her convulsions happen at night, but she responds really well to the treatment. I have never, you know, she would say, but it has never provoked a seizure. And, you know, because you're working on an energy level, I don't really see how it can. But, you know, anything can happen. You never really know. And I was very cautious about giving her a treatment. And I made sure I had her consent. I said, Jean, you sure you really want this? And she said, yes, it's all right. She said, if I have a fit, I have a fit. You'll look after me. But
Good point.
I mean, she's very philosophical. She's had it so long. She just accepts it as part of her life. And the only contraindication that I know of with reflexology, is wonderful in pregnancy. Even, you know, you might get a woman coming to you who's trying to conceive. She may not know she's already pregnant. You're not going to disturb anything. Babies in the uterus seem to love it. They dance for joy when you go along the side of the foot here, this side.
Yeah.
This is on the side here. You've got the uterus, if you're talking about a woman, and the ovary is on the outside, and the uterus is on the inner surface. And we've never been told, we used to be, but we're never told now that you can't do reflexology in the first trimester. I've had some success working with women during pregnancy. It's especially good if I had one client who came to me and she'd passed her due date and she didn't want to be induced, she wanted a natural birth. She was, you know, I said, look, babies come when they want to, when they're ready. I gave her the treatment and the next day she delivered. So whether that was because of what I did, I don't know. But I could feel the energy of the baby coming through, and it's almost like you can see a shadow with the legs here and the head up here. I was told I was seeing things, I was imagining things, but to me it seemed very real. I was very aware that there was another life in there. And the thing is, people need to come on a regular basis. You know, I've got another client who's trying to conceive and she comes so rarely, it's almost not worth doing it. I give her half reflexology and half healing and she loves it, but she doesn't come regularly enough. She's got a very high-powered job. And, you know, she's gone through 4 rounds of IVF, and I have to say to her, it's your lifestyle. You've got to choose either your job or your baby. I'm not saying give up work altogether. I'm saying try and do something a little less stressful, not so much travelling around the world, or go part-time or whatever. I don't like telling people what to do, but it just makes so much sense to me. Anyway, it's certainly useful. I mean, I've chosen to specialise in working with people with cancer. There are other therapists who choose to specialise with women's problems, you know, from puberty to menopause and it's very, very successful treatment, particularly with menopausal symptoms. And, you know, with our patients on tamoxifen, cools them down. Hot flushes are not a severe symptom, but they're quite distressing and sometimes people can't sleep. So, and I can give them the points where they can massage their female reproductive organs. Maybe that helps, but I've never really come across a condition that I can't help. I'm not saying I'm treating somebody, I'm just making them feel more comfortable. When the body is relaxed, it's much easier to heal. It's very difficult for the body to heal when it's all over the place. So relaxation is an essential part of any treatment. And I did a bit of Chinese foot massage, they call it. It starts off wonderfully. You have a lovely warm foot bath and they put herbs and flowers and scents in it. And while you're relaxing in this foot bath, they come behind you and give you head and shoulder massage. After that, they dry your feet and they start torturing you. That's not my idea of a treatment. I mean, they work along all the pressure points. Some of them are so painful, and a lot of them don't speak English, so you know, this is in China, so you can't say to them, well, they understand no. But, you know, it's just a totally different way of looking at things. And I'm always very mindful about treating the whole person with respect and you know, being mindful of their needs. And I'm not going to give them something that they're not in total agreement with. It's giving them, you know, it's working together. I'd just like to say my colleague Joe here does quite similar work to me. I've had treatments with Joe Did you want to just say for a minute what you...
Yes, I mean...
biodynamic massage.
I had training in biodynamic massage, which is very much working with the person. Actually, we learn to use stethoscope, listen to minute changes in the body. I don't do that, but I've used it. The fundamental wisdom of the therapy, I find it amazing how. So I always say to people, it's working in partnership with a person. So
Yeah.
I will notice where if there's any kind of resistance and respect that and meet that person. And I work with a very often a combination of massage and healing on one that I believe really complements the other. That when the person is feeling more relaxed, I find that the healing works. It has a clear passage, if you like. And when I heard you talking the other day, my ears really pricked up because it's lovely to hear that you work in combination with.
Well, my experience of having biodynamic massage with Joe is that I felt like it wasn't so much of a massage as a complete body treatment. When you have a massage, it feels very physical. Every time I go away, I have a massage, and they're so different. A lot of them are just working on the body. Now, that's fine if that's what you want, but to me, including the other layers of the energy really enhances the treatment. I don't use a stethoscope, but I'm listening. I'm listening, and I'm learning by touch. I'm getting feedback. I'm not just touching somebody, I'm waiting for the response. And sometimes when you take for instance the one we've talked about, the adrenals, you gently massage it, and it will say to me, thank you, you can let go now. I might come back to it later, but there's this real feeling that I'm including everything. And it's a wonderful way of working, and it's only in its embryonic stage because, I mean, to be honest, I've always been a very practical therapist. I'm very mindful of going through the right routine. But all along the line, I'm picking up so much, I've had to incorporate it. And I will give people feedback. I don't say to people, oh, you've got a problem with your shoulder. I might say, are your shoulders a bit sore or something? I can pick it up, but I have to be very careful not to put that into somebody's head. I'm just saying what I'm experiencing. And it's amazing, really. I mean, I've got one patient who, from the cancer support group, I won't give out names or anything, but he had cancer of the esophagus. When I first saw him, I seemed to have a rapport with this guy. He's very quiet, but he's got a very deep kind of energy, very thoughtful. And the first time I saw him, I could feel here, this is where we do this esophagus here. It's a line that goes down, I need some feet, but it goes down from the big toe, this is on the left foot, and it goes into the stomach area here. This is a bit different, but that's roughly where it goes. And I could feel in this line was a little kind of obstruction. And I thought about it. It's the bit where the esophagus goes into the stomach and there's a valve there. I tell you, I've learned more about anatomy through practice than I could ever learn from a book. We have to spend time learning anatomy and physiology, obviously, and I've done pathology and things like that, but it's the practice of it. I can feel, and I said to him, where did you have your cancer? He said, esophagus. I said, I can feel it. I must have been working with that group 7 years or something, and it's getting better. It's going. The scars on the outside heal quite quickly, maybe a year, maybe less. Inside, the body takes much longer to heal. If you've had a knife, if they've been in there with surgery, it's going to take much longer to heal, and people often don't understand that, and this is from my own experience as well. It takes years, really, for the scarring to resolve. And then this guy started falling over. People thought he was drunk. He obviously wasn't. But he used to suddenly black out. So they did all the tests. And he had a heart monitor. And they found he needed a pacemaker, so they gave him a pacemaker. I can feel it. It's weird, but maybe it's because I know he's had a pacemaker. But the heart is there in the middle of the left foot, the ball of the left foot. That would represent the heart. And I thought, well, this feels a bit lumpy. And on the outside edge there, I could feel something hard. Pacemaker. I don't know, it could be my imagination, but I could tell that that organ had had something done to it, or was, was reacting in a certain way. And, just simply by feeling his pulses, they were bouncing. So I knew his circulation was really good. And of course, it's quite difficult. I would never say to somebody, when I'm feeling the femoral pulse. I never say, oh, it's a bit weak or something like that. They'd have a panic attack. It's just something I observe for myself. And a lot of drugs impair circulation. And we can do a lot. I do a little bit of massage on the lower leg and, but even with people with very swollen feet, it doesn't mean you can't massage them. They love it. It's, sometimes it's a bit off-putting for people to touch a hurt part of the body. It doesn't, I kind of put a healing hand on it. That's what does it for me. So, yes, Joe.
Something fundamental which I left out was how we learned.
Can you speak up a bit, please?
We learned, one of the first things we learned about biodynamic massage is how the body protects the fragile self from pain by armouring, either by fluid or by muscularly armouring. So when I work with somebody and there is tension and tightness there, I'm sort of meeting that part with respect, and I found that was been really helpful. And to try to force anything,
it doesn't work, does it? It does
not work, and in fact it can
make it worse. Yeah,
absolutely. So the respect is really important.
And above all, it's. I do feel that patients are treated with respect, dignity, and compassion, but it's kind of on a different level. They have to be much more distant than we do. They have to be very careful about things like inappropriate touching, all the new protocols. We have to have a patient sign a consent form now in the hospice. Well, when they come to me at the hospital, they've automatically consented by asking for a treatment. But in the hospice, we have to have written consent, which is really important. And there's certain rules that have changed and certain protocols that have been put in, which in a way does take things away. On the whole, it's not us attacking patients. We might get patients attacking us, but Yeah, so, yeah, I think we're going to have a tea break now. Please feel free to ask me any questions or talk to each other. If anybody, yeah, she's trained in all these things. What it incorporates is osteopathy, which of course, as our friend will tell us, involves a very detailed study of the skeleton and all the muscles, a very detailed study of the anatomy and physiology of the body. Craniosacral. I mean, I did go to a presentation about craniosacral reflexology, and it was really so complex that I couldn't get it into my head. We have somebody at the hospice who's a craniosacral therapist. Craniosacral is very much a form of healing, of balancing, and that kind of thing. It's very powerful. Patients love it. And you know, one of the things, I wouldn't say I have against the medical profession. I'm not against the medical profession, but they don't go beyond the physical. Recently, there was, I mean, everybody knows that the basis of health really is nutrition, diet, and what we eat. We are what we eat and all that. There's been lots of books about it. Doctors, apparently, Tim and Mike, have never been given any more than about an hour in their training, 7 years or whatever it is, about nutrition. And doctors have been recently complaining that they don't know. You know, they'll say, oh, go and see a nutritionist. Well, a nutritionist, they have a dietitian. Dietitian is totally different from a nutritionist. Jill is a nutritionist. It's about using food as a medicine, really. And there was one patient who came to me and she said, you know, Jane, cancer has done me a favour. I thought, yeah, you know, you lost your hair. She was also type 2 diabetic. She said, it made me aware that my lifestyle was making me ill. She said, I've completely changed the way I eat, the way I look after myself with my exercise and all this kind of thing. It can be, you know, like a life-changing moment. It can be. Instead of somebody thinking it's coming towards the end of their life, they're thinking, I can change for the better. It's exactly what happened to me with my back. You can't sit around feeling sorry for yourself. You have to use that energy to do something positive. So my patients have taught me such a lot, you know, in terms of, well, they have to look after themselves. They've got no choice. It's like, if they don't, you know, the chances are, if they look after themselves with nutrition and exercise and all these other things, they will have a better quality of life anyway. And that's what we want for everybody. So cancer isn't necessarily a death sentence. It's a wake-up call for many people about what they could do better in their lives. And as far as I'm concerned, one of the things that I tell people, do everything you can to enjoy the things you love. That is life. Life is there to enjoy. And, you know, try not to sweat the small stuff. Just do what you love. And, you know, the rest will take care of itself. Life should be fun. It shouldn't be an endurance test. So that's my best advice I give to people. I don't really give people advice except how to look after their feet, but I just say just have a bit of fun, meet your friends, you know, go for a coffee, go for a walk in the park, do anything you love, you know. And there's all these things cropping up now: art classes, yoga therapy, chair-based exercise, art groups, everything is coming, you know, so people have a better experience of life regardless of their illness or how long they're going to live. So yeah. Shall we have a cup of tea?
So, tongue's hanging out, I'm sure.
Yes.
What would people like to do? I mean, you've given us a huge amount of your passionate belief in and obviously, you know, demonstrated how well reflexology works in your hands. Do we want to come back? Shall we just have a networking break, refresh ourselves? Do we want to come back for any further question or answer or anything like that, or do we feel complete? Do you have anything else you wanted to say?
Anybody want to heckle?
We can do that one-to-one during the break. So.
Right.
It sounds like probably we are complete. I mean, you've given us a good hour and a half, which is fantastic. And
I didn't think I would be able to go on that long.
Demonstrate, you know, how enthusiastic you are for what you do. It sort of comes over loud and clear. Really good.
Thank you.
When you were talking about the relaxation, I just wanted to sort of give a little bit of information from the Dr. Healer Network. And one of our oldest members, a Yorkshireman, he said his definition of healing, he said it's the 3 R's, you know, it's the 3 R's in a very rural accent. It's like you've got to relax, and then you've got to release, and then you've got to re-energize. Which is really, I mean, that's making me think, yeah, well, you know, with havening, you're releasing some sort of held on, sort of encoded trauma or whatever, memory. You're helping release that with what you're doing. Reflexology, I mean, times I've had reflexology, I've been off with the fairies. It's been like, you know, amazingly relaxing.
It wasn't me.
No, it wasn't you. And then meditation, when we're teaching people to meditate, we say, well, look, when you're so relaxed, you may find stuff being released. You might be, you know, just sort of letting go, and the subconscious releases some form of, it might be an emotion, it might be, you know, pain, it might be, you know, you just want to have a scream or...
I think the best thing about relaxation and meditation is that it gives you a free mind, so that you're not thinking about all the things that you've got to do. It frees your mind, so it gives you clarity. So, you know, you may not get messages coming through, but just being in that state of relaxation can inspire all sorts of things. And, you know, it's the same with havening, isn't it? Havening is a kind of healing.
Yes. You mentioned about research and evidence, and we've been accepted in the clinical trials in America. I've just come back. We came back from the USA yesterday, so we're a bit
jet lagged.
So maybe in the October, if we got acceptance for publication, we can actually say something about the trials that have been phenomenal in terms of their p-values are really exciting. So
well, so many people suffer from PTSD.
Oh, don't ask me.
I mean, you know, we've had so many wars
I'll tell you what, if it's all right for a couple of minutes, the basis of one of the elements of the research is looking at type D personalities. Now, I know type A and type B, that's what we're familiar with. Type D personalities is disease-prone personalities, and that is looking at immunity, heart disease, mental health, stress-related. And in the evidence for the research that we've done, there's a paper that looks in over 200 countries, the incidence of disease-prone personalities between 27 and 37%, which is a phenomenal number. And you know, PTSD would come into some of that with mental health issues. So if we can alleviate just a bit of that in that population, and the research that we're showing shows the effectivity is between 1,000 and 10,000 chance that it's random, the results. It is so effective. So, you know, there's stuff out there.
Yeah, and that's talking about resilience, which is a very important area. I don't think we shouldn't be talking about it
No,
today.
but it goes in with the whole.
And chat and one-to-one. So I'd like to thank you ever so much for a really wonderful talk.
You're very welcome. Thank you.